Hey Cyril, how you going?
Hello, Rob. Welcome. Thank you for joining us today, and we look forward to hearing about the clients you've been treating.
Yeah, hi Cyril. It's Doctor Rob Willis speaking here from Wangaratta. I've been doing a few more scans this week, and yeah, certainly the the results are continuing to come in, which is really exciting. And I think for every animal that's coming to me at the moment, the owners or the clients are then bringing in another animal or arranging another horse to be seen or another dog when they weren't expecting to, or sending their friends or other family members and their animals in. So, yeah, certainly been going really, really well, and especially on the back of doing the animal training course there a couple of weekends ago. It's nice to have got a lot of feedback from people that are also using it and just hear their stories too. But yeah, a couple of really good ones in the last couple of weeks I've done. One's a little dog I saw yesterday. It's a much older dog, a 16-year-old dog, and it's actually been having a lot of breathing problems and waking up having fits, that what the owner describes as fits, in the night. And yeah, a lot of respiratory noise and nasal sounds and lung sounds. And the vets have blood tested it, and being 16, they've put it on a bunch of medications as was needed, and still not going very well. She was very worried and thought this little dog might need to be put down sometime late this week or early next week. So, and that was kind of the information she'd been given as well. And anyway, so we did a scan, and it was a really good little dog, and showed up quite a few things. The lung driver was a complete blockage, complete red, and we also had a complete blockage on the kidney driver as well, which was interesting. And just the ERs pinpointed like lungs and tonsils, paranasal sinuses, esophagus came up, which was interesting too. But the real little pearl of wisdom in the scan for this dog was when I went to the toxin screen. It showed up with smoke at a red level distortion up at 100%. So I asked this owner, I queried her about smoke in the little dog's environment, because it's only been going for a couple of months. And I said, has anything changed at home? Any smoke, or, someone smoking cigarettes near the dog that wasn't previously, that sort of thing. And she said to me, no, not like that, but just with the winter, they've got an old house and an old fireplace. It's an open fireplace. And she said it does put out a lot of smoke into the house. So, and been going on about the same amount of time as this little dog's been sick. So, something like that, in a 16-year-old dog that I think the dog might have been 2 or 2.5 kilos in size. A lung capacity, if you close your fist, each lung might have a capacity of sort of half your fist size sort of thing, if that. So a little dog at age 16, where the lungs and everything are deteriorating anyway, is just not going to handle that much smoke. And even in the little day out, they travelled a couple of hours to see me, even in that day of being out in fresh air and coming down to me and giving it the lung driver, kidney driver, and some BFA. The owner was very surprised at suddenly how well the little dog looked. So that would be another example of something where it lined up really well with the blood test results that the dog had at the vet, but also, yeah, definitely. There's no other way anyone would have ever guessed it was due to basically smoke inhalation in the house. And interestingly enough as well, she had actually bought a humidifier. She thought maybe if she put a humidifier.
Fantastic, because it's an area that people often don't spend too much time on, and unless it's really obvious, and you've been able to link it directly, knowing what's happening with the fluids on the lung. So she really needed a dehumidifier and maybe an air ionizer to drop the particles of smoke out of the air. That's fantastic. What you mentioned there was another one as well. Oh yes, sorry, the cushion dog, Lynx. Maybe if you want to have a talk about that, because you were able to actually revisit the diagnosis, and with what you saw in the NES, you were able to refine as to where it was, and now you've proved it with testing, I believe. Is that right? Is that what you did?
So Link was a little Jack Russell, a little terrier cross that came and saw us at the animal training course in Albury, and he was a really good one actually, because he had just come back from the university where he had seen some vets up there, and he had came back diagnosed with spinal stroke, but it hadn't been diagnosed as such. It was just kind of the best thing they could kind of find, given given his symptoms, they didn't do an MRI, which is really, as far as I know, the main thing we use to diagnose them. So, yeah, I guess the diagnosis in some ways came back. He had a CT scan, he had some X-rays, he had a couple other things, blood tests from memory, but basically came back with, we think, a spinal stroke. So since he had returned home to the owners, he had got progressively worse. He had been unwell for quite a long time. And, we probably had a day down there, as anyone would know from that animal training course. It was about -3 degrees and getting colder, and the heaters weren't working really well. So everyone was freezing. And this little dog, I just noticed during the day, he had been panting a lot, which is really unusual for a little dog to be panting in those cold conditions. So he was used as the demonstration, and once Cyril scanned him and the results came up, I was having a look, and one of the things that really interested me off the back of the scan was the adrenal glands were pinpointed from the provision in the ER section, and we do know there is a hormonal disease with dogs of the adrenal glands. There's two. You can have underactive adrenal glands and you can have overactive adrenal glands. And just when ProVet pinpointed the adrenal glands, I thought that was quite interesting. And the muscle driver coming up as well, I thought was fairly interesting, because those conditions we both see, whether it be the underactive adrenal glands, which is Addison's disease, or the overactive ones called Cushing's disease, both of them result in muscle weakness and extensive muscle problems. So when I saw the adrenal glands pop up and the muscle driver come up with a full distortion, I thought there was a real possibility that this little dog may have had either Addison's or Cushing's, and particularly with the panting for the day, potentially it was a Cushing's dog. And so we ended up recommending to that owner, off the back of putting a few things together, and particularly the NES scan, getting my brain ticking, that perhaps this would be worth asking her local vet to test for. And she did. She went and asked the vets, and the vets were good enough to assist us with that investigation. And lo and behold, within about 48 hours, we had a diagnosis came back of Cushing's disease, which was just fantastic, because it's not a brilliant diagnosis in itself, but at least finally we had the correct diagnosis for this little dog. And it is a very difficult disease to treat, even though we have got the right diagnosis. But certainly with the help of NES to identify it, and also with the infusical regimes we can do, it'll be a very interesting little dog to treat, and just see if we can help this dog out a lot, because Cushing's, it's a difficult disease to treat, but it's also a very expensive disease to treat. So if we can assist the owner with his treatment, hopefully we can get a really good result and keep her costs down. So yeah, that was another one where you could link in the work that the guys had done at the uni with what the dog was showing in with the scan, and go, well, hang on, this is all pointing towards something else other than what he's being diagnosed with. So yeah, so that was really pleasing when that positive result came back. Human practitioners that are currently using NES, I'd really encourage them to look at obtaining the animal system. The animals certainly respond really well to both My Health and Infoceuticals. They seem to respond quite quickly. The onuses notice results quite quickly. And look, in animals where a lot of the time it's really hard even for vets to work out what's going on, equipment like this is just priceless, where it will pinpoint things so accurately for you. And even some of my colleagues, my veterinary colleagues, I've shown when I've scanned animals, they're blown away by what it will pick up, even if they've not previously looked into energetic medicine or anything like that. So I think it's just a great tool to have as a practitioner. If you're already practicing, as a human NES practitioner, why not try the animal system as well? Because there's so much overlap energetically between your human patients and their animals, and I'm sure you'll be getting asked if you can do animals too.